Dr. Jeyaprakash, would you like to share your screen, please?
Yes, sir. First of all, it's a very good evening to one and all. It gives me immense pleasure and I'm honored to be a part of this webinar. I thank AOS and office bearers for this opportunity.
Pterygium is a degeneration of subconjunctival tissue which proliferates as vascularized granulation tissue to invade the cornea. Prevalence of pterygium has increased many folds, and that could be the result of dry eye during COVID-19 pandemic. Treating pterygium is essential when it causes corneal astigmatism, encroaches the pupillary area, cosmetically disfiguring, or if it causes recurrent inflammation and irritation. Pterygium is gently peeled from the cornea. Conjunctiva and the pterygium is dissected. Now, the head of the pterygium and its conjunctiva and the body excised. After excising the pterygium, the graft is dissected from the infratemporal bulbar conjunctiva. Before cutting the graft at the limbus and by holding the free end with McPherson's forceps, the flap is pulled up and multiple small fenestrations are made with the help of 26 gauge needle, and then the flap is freed from its attachment at the limbus. Free flap is kept on the cornea and the scleral bed is prepared by cleaning the clotted blood, and gentle smoothing of the raw area is done for the fresh bleed. Meticulous care is taken to place the flap in the exact orientation, that is, epithelial side up and the limbal end along the limbus. Graft is stretched and the recipient area is completely covered. Ironing of the graft is done to have better adhesion. Its direction should be from the limbus towards the periphery. Excessive graft can either be trimmed or can be tucked under the normal conjunctiva. Care is taken not to irrigate the flap once it is placed. Gentle cleaning of the excessive bleed is done with cotton swab. A moistened cotton swab can be placed on the cornea and wait for 3 to 5 minutes so that the graft is nicely adherent to the scleral bed. Conjunctival limbal autograft with autologous blood fixation in pterygium surgery is an effective and widely followed procedure. However, graft edema, graft displacement, and graft loss are common complications. This technique has significantly reduced the graft edema, graft displacement, and graft loss. Advantage of this newer technique with autologous blood fixation is to improve the outcome of conjunctival limbal autograft without the post-operative irritation by sutures and usage of expensive fibrin glue. Thank you.
Thank you, Jeyaprakash. That was a very nice video that you showed. Fixation of the graft with the blood. The only difference, it has been described before, the only difference I could make out was that you're making fenestrations there on the graft. What was the idea of making, what was, in your mind when you made those fenestrations in the graft?
As we are doing fenestrations, the chance of edema getting under the flap and also lifting the flap is less. And you can also expand the graft as per the size necessary. And when there is a bleed underneath the graft, that can also ooze out through the smaller openings that we have made. So that is how it works. And I've seen a lot of cases with not doing a fenestration where the graft is totally lost on the next day or even the second day. So by doing this technique, I've not seen graft loss. There has been a few cases with mild retraction of the graft, and that was in the medialmost aspect where the graft was placed on the medial rectus muscle. So if the graft is smaller in size, the chance of edema or the chance of rejection or the graft loss is very, very minimal.
How is graft loss increased by fenestrations? You can say that it will not allow if any fluid to accumulate below, it will get seeped off. How will it prevent loss?
I think possibly the adherence. Okay, Jeyaprakash, you answer.
Because the adherence is slightly more than when compared to a normal graft.
Nice.
So
Yeah, can I offer a comment?
yeah, Sumit.
Yeah, Dr. Jeyaprakash, wonderful video and a wonderful innovation. What is important is whenever you are presenting an innovation, you must highlight what are the key features that you are adding. Okay, so you're kind of all that you wanted to say, Dr. Namrata brought that out, kind of squeezed it out of you. Because your video was mostly addressing, and towards the end also you said you're talking about autologous serum or blood being used for, as an addition. Your key points were a larger size graft and fenestrations. Correct, that was your innovation. So please focus on that in the next video that you make. And just to answer Dr. Chitra though, that it basically when you make fenestrations, this works for across all mechanical devices and things. When you make fenestration, they act as rivets. So they act as rivets and they kind of allow you to hold on to any tissue or any two surfaces. It helps get a better grip. So that's how these fenestrations work, right? So please try to focus on your innovational points or your inventive concepts more in your next video.
Yes, sir.
Well, and thank you, Jeyaprakash.